Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face the Facts, we're going to discuss another issue that audience members have submitted, which is when should you start Botox and filler? This is one of my favorite questions because there is a lot of stuff out there and everyone kind of has their own opinions on these things. So I'm speaking just for myself, what I think as a facial plastic surgeon. But here we go. So first of all, Botox, umbrella term for all neurotoxins, Dysport, Xeomin, etc. These all fall under the same things. The way these work, quickly breaking it down, is that they will inhibit movement of your face if it's injected, right? And so my recommendation is personally that you don't start doing Botox or any kind of neurotoxin treatment until you start noticing that you are forming lines with movement that also stay there when you are resting and not making movements. So a lot of times people will start because they're like, oh my gosh, I make a line when I raise my eyebrow. But guess what? Even kids do that. And I don't think they should be getting Botox, right? So it's not a matter of do you make the line at all as much as it is, but do you also notice when you rest that the line is still there? And when it's starting to be there even at rest, that is the time when you should start because it is still early enough that we can get these toxins in you, and hopefully with some good skincare, etc., some collagen on your side, you can get those lines out of you so they are not there when you are resting. So common misconception is doing it when you see the line or waiting until the line has been set in, etched in, carved into the face, and then honestly, no amount of Botox is gonna get rid of it. Just saying. Okay, next is filler. When should you start doing filler? So this depends on what your goal is with filler, and just quick brief outline of filler. Filler is a gel-like substance that's almost like toothpaste. You inject it, it's kind of like Play-Doh. It creates a mound or something somewhere on your face. So when should you start doing this? This depends on whether you are actually trying to change how your face looks. So for example, if you've never had cheekbones and you want to add cheekbones, you can start doing this really kind of whenever you're done facially developing, which might be somewhere in your 20s, depending on your age of puberty and all that stuff. Versus if you're trying to do it for anti-aging effects. If you're trying to do it for anti-aging effects, then you really need to wait until there's been, a pretty substantial amount of loss of volume of your face, which can be from the fat pockets themselves or from the bone. And usually this tends to be in the 30s, but definitely closer to the 40s range. That would be the time to start doing filler for aging purposes and not just because you want to change your overall look. So those are my kind of global guidelines. Again, take it with a grain of salt. Sometimes it's gonna be a little bit earlier, sometimes it's gonna be a little bit later. Whichever group you fall into, this is why it's important for you to have a customized consultation with your injector so that way they can see how you animate and how you look and what your goals are to figure out how best to serve your goals and your needs. So those are my personal opinions. I'm Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. I'm not speaking for anyone else here, just what I think, and hopefully you learned something, and we'll see you guys next week.